So how do we want to apply and how do we want to use tape to our benefit in practice? What are some scenarios that we want to use it for, and what are the reasons for using it? Now, as I had mentioned already with kinesiology tape is used to modulate pain or sensation, provide better kinesthetic awareness. So there's some kind of neuromodulation. So anytime we have to perform that or ask a patient to go through some kind of movement where we're trying to overcome pain or provide better stability, then this would be an opportunity to use kinesiology tape. If we have a patient who's reporting having, pulled something in their back as they're shoveling snow per se, then we could use biomechanical tape to kind of offload and deload those structures. So again, in those situations, we could use tape to our benefit. We know that tape works just as well as ice, heat, biofreeze, or analgesic creams, icy hot, right? And the benefit to using kinesiology tape over those modalities potentially is that it can be used for a longer period of time, as long as the patient can tolerate it and it's applied appropriately. Now, part of getting the response that you want from using these tools is using it in conjunction with other treatments, right? That if we just rely on just kinesiology tape or biomechanical tape by itself, it's probably not going to get the best bang for our buck that we really are looking for. And if we use this, let's say after some kind of joint manipulation, we apply some tape. Again, those are tools that are being used to help facilitate better movement. So again, following up with some kind of exercise for the patient would be beneficial at this point. And that by having the tape on the skin for an extended period of time, it's providing a stimulus that's going to be experienced frequently throughout the day, consistently for several days in a row. So again, if we're trying to undo, let's say, a motor pattern, okay, because they have been walking with an antalgic kind of gait, that if we have the tape applied to the appropriate tissues and it decreases their perception of pain, that it might be easier for them to kind of regain and kind of return to kind of a normal pattern because we're not experiencing that pain, that discomfort as much. So again, that would be the kind of the benefit to using the tape over maybe some other modalities. It's fairly cheap for most of these tapes and can be a better option than some other modalities that would require a big investment.